What are massage therapists so often misunderstanding about the nervous system?
I think a lot of yeah, that's a really good question. And again, I'm going to start with it's not just massage therapists. It's manual therapy. And it's not just manual therapy, it's popular culture, it's all these things. There's a very big 1960s they came up with something called the biomedical model. And the biomedical model is the one that states that, the hip bone's connected to this bone and that bone and the gears and levers inside the body. That model in your first acute phases of injuries, subacute phases of injury, and for some injury types, first 3 months is really valuable. I think people think that because that model exists in the acute phase and the subacute and potentially up to 3 month phase in healthcare, that it persists for the chronic and the rehabilitative phase. But the theory, the popular theory right now in pain neuroeducation, cognitive behavior therapy, but even the biopsychosocial model of healthcare, and especially what we're seeing with a lot of newer education in manual therapy across the board, because I don't only teach massage therapists, I teach at a lot of other places as well, is that the biomedical model post 3 months, not that it's not relevant, but it is far less valuable. And that we're moving into a neurosensory component where the sensory system becomes involved with touch therapy. So our impact on that system needs to change. 2 years later, if your ankle is still sore and you take an x-ray and an MRI and we see that diagnostically that there's nothing wrong with it, but the pain still persists, we can't continue to treat that ankle as though it was purely a mechanistic problem with the structure. And essentially we see that structural imaging does not correlate to levels of pain. We don't see that connection anymore. And I think that's probably one of the bigger things that is still missing in manual therapy, is that we still think that because it was an injury in its origin, traumatic in nature, therefore mechanistic in nature, possibly, that years later, it's still mechanistic in nature or structural in nature, when it may actually just be an upregulated, downregulated nervous system. So, the manifestation of pain can come from a multitude of sources that have nothing to do with mechanistic input. And therefore, when it comes to manual therapists treating them mechanistically, you can't think that that's the reason they got better. It is simply our bridge and our tool to a level of safety and a level of wholeness with our client where they feel better for a multitude of other reasons that might even beyond our comprehension.